We're looking at the inside of the nose here. This is what it looks like before. She's got a little bit of a septal deflection there. This has also been decongested already. The cleft on the left, which is the breaking point from what she had, looks like a septal fracture possibly. And that's where her sinuses drain. So the first step that I do on the turbinates is I'm going to go ahead and create some space by moving the turbinate over. There's a little bone, so I'm going to try to get underneath it. Okay, you're going to feel a little pain and discomfort. I'm sorry, you're going to feel pressure and you're going to hear a cracking sound. I know that's uncomfortable, but that's music to my ears. That's just the sound of that bone and the turbinate moving. Ready, 1, 2, 3. Oh, it's a lot of weird noises, but that's part of it. Getting rid of all the nasty tissue that's been sitting there for a long time. Not really contributing. We use RF, radio frequency, actually. So it's almost like a burn. You might feel a little bit of heat here. Now watch this. Go ahead, just open your eyes, breathe through your nose. You feel a big difference there on that left side? We're just injecting into the septum wall to divide the left and right side of the nose. When we inject the septum, not only do we get the benefit of numbing the nose, but if you get in a certain plane, it actually lifts up the lining of the nose, which makes it a little bit easier for me. It's got a hydro, which means water dissection, essentially. So if I get in a certain position, and if I get it just in the right spot, a lot of the lifting of the septum is done for me. Okay, this is all done. Now I'm gonna make up what I call a hockey stick incision. It's almost like a J-type incision. Starts at the floor of the septum and then it goes towards the front and then up. Then I'm gonna go ahead and you can see the white. I am lifting up, this is called a perichondral flap, or a flap, which is the lining of the septum. So as I advance it, septum's opening up the flap is opening up quite nicely. I'm gonna make an incision through this cartilage, and I just need a strip. I'm gonna go ahead and lift up the flap on the other side. Again, the goal is just to take a strip down. Good, that's a crunchy sound, we expect that. Go ahead and move that cartilage over. That crunchy sound is music to my ears. Now I'm gonna take a strip off this cartilage and maybe a little bit of the septal bone. And then I'm gonna go ahead and remove it. It's working out nice. So I'm gonna free this cartilage, and it's already freed. There's a flap that I'm moving over now. And I got some residual cartilage. Good. That looks good. This side looks fantastic. So the septum is preserved, the mucosa of the septum is preserved. This will kind of seal the deal more or less. It also what we call lateralizing the inferior turbinate, which means that it pushes that inferior turbinate back into good position also. So we're creating some space. Now I'm gonna go ahead and blow up this balloon. You're gonna hear a cracking sound. The cracking sound is not the septum, just the balloon. Go ahead. It's a lot of pressure. On the side that is most affected, I usually keep it there for a minute or two. And then the balloon deflates, we rewrap it so that I can put it on the other side. And I'm gonna replace it in here. This will fit much easier. And then we're gonna go ahead and inflate this side now. A lot of pressure. I'm just gonna hold for like a few seconds here. I'm not gonna hold this side too much. And that should be enough. Got her septum is now in the right in the center. This is a perfect outcome. You couldn't have any better. You can see the septum is completely straight. We can see all the way back. And we can see the septum now. We're gonna go all the way back. This is beautiful, plenty of space. You can drive a truck through it. This was the bad side again, all the way back. We have the septum on the right side, the turbinate on the left. That is a beautiful result. All the way back, it looks beautiful. That's the back of the nose called the nasopharynx. That's actually the eustachian tube on the left. That little area right there. but this is a perfect nose. The evidence is, look at her face. Can you breathe through your nose? Night and
Yes,
day.
I can.